we described, if we take a look at the chart that we introduced on May 15th, it had 5 levels. Critical in the deep red, which we were never in, thankfully, in North Dakota. Other states were in there and stayed in there a long time. We were in a high level is what we started out initially. When we introduced this scale back on May 15th, we made a determination based on a number of criteria that the entire state was in the moderate or that yellow level across the state, and we want to, and again, just be grateful to all of you and all the work that were done here that we were never at that red level. When we looked at the guidelines that we have under Executive Order 2020-06.7. These are strictly guidelines, and so there's a set of guidelines for generally for businesses and for specific industries that relate. So when we move from one risk level to another, it triggers a change in all those guidelines. And after thoughtful consideration and inputs from health professionals and from the business sector as we work to try to save lives and livelihoods, we're making the announcement today, a significant announcement that we as a state are moving the entire state to green from moderate. And so with that, we're moving into what we call the low risk area. Again, to be able to do this, I just want to say again, thank you to the people of North Dakota, because it's your actions, your individual responsibility, which has produced the great data, the low numbers, the low cases, the low utilization of hospital, the low spread, the fast responses, the collaboration. I mean, all of that is what's happened here again. And I'd say that when we talk about North Dakota Smart, North Dakota's been very smart to date, and that goes back to all of you. When people will ask about the timing of this, what does this mean for businesses? You should go to the ndresponse.gov, take a look at the guidelines that are specific to your industry, take a look at the ones that are general for everyone, and then as you feel that you can meet those guidelines, feel free to move to the next phase of reopening when you're ready to do that, and when you know that you can take care of your team members and your customers in a way where you can keep them safe. People might say, why now? There's a number of reasons of why we felt now was the time to move to the green level statewide. The high testing rate, again, when you've got more data, you can be more confident. This 9% of the entire state that's been tested, and then a big portion of those have been tested more than once. And we've got our testing capacity that's growing with new machines coming on at the state lab and new partnerships. We feel very confident about our ability to have good data going forward. Key criteria was adequate number of hospital beds and ICU capability. And again, that capacity to be, our ability to deliver care at the highest level for those in the most need. And at no point have we had more than 2% of the hospital capacity in our state going towards COVID, which is great. And then in terms of actual, low rate of active cases, even when we take a look at this number of cases now dropping below 600, that is 0.08% of the population. And we've also had a very low positivity rate the entire time. We were, often in the top 5 or the states for the lowest positivity rate. We've climbed up a little bit. I think because of the great job that we're doing on our targeted testing, we've moved up a little bit, but that gives us a sense of the strength of our capability. That we're a state that's trying to find positive cases and isolate them. We're not trying to artificially drive our rate low. And again, great exercising of the personal responsibility and great work on the North Dakota Smart protocols and guidelines. Also, just on the fatality rate, 2.3% of the cases in North Dakota have resulted in death, and that is one of the lowest rates in the country. And again, I put that back on the strength of North Dakotans as individuals, but also on our ability to deliver care at the highest level. We did take a look. We've got the chart up here with all counties looking green. We did take a look at this at a county by county level, and And of course, we had some counties that already have, very low population density, which has allowed for great social distancing since statehood. We have had, so they were ready to go when the pandemic hit. We've had 20 counties that right now would meet all 11 gating criteria to go to green. We have there's 11 criteria. 52 of the 53 counties meet 7 or more. Cass County was the only one that didn't meet 7 or more. But again, when we took a look at Cass County, there's only 0.25% of the population of Cass County right now has an active case. And because of our contact tracing, we know where those folks are. If they worked in long-term care, and were positive, they're at home and in isolation. If they're positive, if they're in a hospital, we know where they are. And if they're positive, and if they're in a long-term care facility as a resident, they're in isolation from other people in there. So again, we have a very small, again, I'll repeat, 0.25% of the population of Fargo right now is an active case. And again, high confidence that we know where those individuals are. So again, as part of our ability to decide to reopen the entire state today, is also, again, I want to give a shout out to the mayors of Fargo and West Fargo and the Cass County Commission and their leadership and the Cass Clay efforts, the Red River Valley COVID Task Force, as we're calling it. Because of that, I would say we know more and have more granularity in terms of what's going on the ground in Cass than we do in almost any other county in the state, because of the energy, the time, the resources, the people, and the contact tracing, the targeted testing that's been going on there. And again, that gives us the confidence that we can go to green for the whole state. Under the protocols, in North Dakota, there's what we call the universal protocols, include the most recent CDC guidance. And so again, we're updating what we have posted online as CDC guidance changes, and that includes best practices, and they're highly recommended for all industries and activities to follow. So whether you're a park board or a fitness center or a manufacturer or a church, there are things in there that apply to everyone in terms of the North Dakota SMART guidelines under the universal protocols. Also, there are industry-specific standards. Those have been revised based on the task force that we set up through the North Dakota SMART Restart, and they've got a lot of private sector input. And changes include providing additional context and consistent language to help ensure clarity for those that are looking to follow those recommendations and guidelines. I'll just give you a few of those. In the personal care area, again, where face masks were originally required for some services and not for others, it's now strongly recommended that face masks are used for services that last more than 10 minutes. In the restaurant, bar, and banquet guidelines, language now specifies that food service for takeout at grocery stores, convenience stores, and other outlets should follow the same guidelines and protocols and customer self-service guidance that were similar to buffets, salad bars, and beverage stations that were applied to restaurants. So again, we can be consistently safe across all forms of food service. And then each of these now have been updated to include specific recommendations for each risk level. So again, whether you're in the restaurant, large gathering, whatever business you are, North Dakota ndresponse.gov, go in there and take a look at the North Dakota SMART Restart risk levels, go underneath there, and you can find out specific things for your industry. For example, I think one thing that people have been asking a lot about is yellow. We were at yellow risk level, which is where we were till 15 minutes ago. We were at 50% capacity for restaurants. This opens up the ability to go to 75% capacity when the restaurants feel they can meet the guidelines. So again, go read the guidelines, and if you feel that you can meet the guidelines that are in there, you've got the ability to go to 75%. And so on and so on. Again, there's like under, hair salons, med spas, massage therapy. Under yellow, walk-ins were not recommended, but green states that businesses in the personal care businesses can utilize appointment systems. They're encouraged to utilize appointment systems, and unless a walk-in system can be used safely. But again, these are all recommendations. There's a number of recommendations for fitness centers, playgrounds, etc. movie theaters, yellow was at 20%, green opens up capacity to 65. For gatherings, again, for event space, yellow we were at 50%, green opens up capacity to 75. And for places where you might have been alternating rows, chairs, or bleachers, green allows for consideration of not requiring alternative rows. Banquets and weddings, green opens up capacity up to 75% of a facility and up to 500 attendees. For people that have June weddings coming up or large events, that will be an important one to note. But again, lots and lots of detail. ndresponse.gov, universal protocols for everyone, industry specific. Go check it out. And again, let's continue to be North Dakota smart as we move to the next level, the low level.